Hello and welcome to Skin News. I'm Joshua Fox, board certified dermatologist and Mohs surgeon at ORA Dermatology and Cutaneous Surgery, as well as Miami Center for Dermatology. Thanks for tuning in and welcome back. Today we have a very interesting article that was published in Dermatologic Surgery in March of 2025. And this is a very interesting article, especially if someone you know is going to have a surgery under anesthesia. And we had to do a little bit of background to understand what this article is about. So when someone gets general anesthesia, there are a number of parameters that the anesthesiologist monitors. One of them is how paralyzed the patient is. So there are two things that an anesthesiologist is doing for the patient who's sleeping. One is they give them medicine to give them anesthesia, so they're sleeping, and they monitor that using various techniques. And then they also will paralyze the patient using medicines that do that. So the anesthesiologist will monitor the patient how asleep they are, as well as how paralyzed they are. There's a technique called the train of four, where they use electrical signals to see if the motor function of the muscles are working. And patients who received Botox, at least in the last 3 months prior to surgery, when they do that train of four to measure the function of the muscles of the patient, will give a false signal in the sense that the anesthesiologist will think you're paralyzed when really you're not, because if they're, for example, measuring the facial nerve, which is over here, and they don't see any twitches, the anesthesiologist will think, oh, you're paralyzed, everything is good. Similarly, there is some connection between monitoring how asleep the patient is and the function of the muscle there. There is some overlap, and they might think you're sleeping enough when you're not sleeping enough due to the Botox you've had. And this study looked at 11 cases where patients received Botox and did not inform their anesthesiologist they had. And during the procedure, they had to change which nerve they were monitoring because they realized the patient was not paralyzed enough or not asleep enough. And so if you are having surgery and going to get anesthesia, or someone you know, make sure you tell the anesthesiologist that you received Botox in the last 3 months, the last 6 months, whenever it is, so the anesthesiologist can properly monitor you to make sure that you're sleeping and that you're not moving during the surgery. Thanks for tuning in. Remember that dermatology is more than skin deep. If you have any questions, feel free to post at the bottom.